Hi, I'm Dr. Chuck. Welcome to Your Filthy Mouth. Today we're going to be talking about the mature mouth. Do you have different dental situations or conditions when you get elderly? Stay tuned and find out.
Your smile is beautiful and possibly deadly. Dr. Chuck is here to tell you how your mouth can hold the key to your overall health. Now, about that filthy mouth of yours.
Hi, I'm Suzanne Lynn, and this is Your Filthy Mouth. Welcome. I'm here with Dr. Chuck, and today we're talking about the mature mouth and special care that we need to take as we get a little bit older. Why is it important?
Well, it's important at all ages, but we have different situations as we get a little more mature, we'll say. One of the things that happens for so many is they're on medications, and many medications will dry out the mouth. And when you have a dry mouth, you no longer have the saliva to dilute the acids that the bacteria are producing, so you have a higher cavity rate. So home care becomes more and more important when you have a dry mouth. You really have to keep it clean.
It's not just about the annoyance of having a dry mouth. You're talking about it maybe causing more cavities.
Right, exactly. So when you do have that dry mouth, and to be honest, most people do a so-so job on their home care. This is why I'm such a huge fan of disclosing tablets, where you can check yourself. It's a good way of testing yourself, and you can get them free you can get them. They're over the counter, I should say. We give them away free at our office, but you can get them over the counter from Amazon, and we got links here on the website where people can go and get them. Yeah. This way, you can check yourself at any age. This is for the young kids, for the middle, and for the elderly as well. Now you can see, am I doing a good job or doing a bad job?
It's a test.
It's a test
to see where you're missing.
If you take a test and it's never graded, how do you know how well you did?
Now, being in Central Florida, I imagine you've got a lot of senior patients. Is that right?
In our practice, we have over 250 patients that are 90 years old or older.
Wow.
It's a big deal. People move to Florida to live, not to die.
Right. So, I mean, if they've been coming and they probably are relatively maintaining on a regular basis, they've got pretty nice mouth at this point, right?
Generally speaking, yes. I've only got a few of them that have complete dentures. Most of them have most of their teeth, maybe some partials in there, but they're taking care of their teeth because they understand. They've seen the consequences, and they don't want to go there.
Right. What are some of the special things that older seniors could consider to help? I mean, I'm just thinking about my grandmother who had terrible arthritis, trying to keep her mouth clean. What are some suggestions?
Well, one of the things you can do to prevent some of the problems is some of these fluoride rinses or fluoride treatments you can have when you do get your teeth cleaned, because the root is 7 times softer than the enamel. Okay. 700% softer than the enamel. So if you have bacteria on the roots, you're much more susceptible to get root cavities, which is where the elderly or the mature tend to get. So if we can protect the roots, that helps an awful lot on preventing the problem in the first place.
It's difficult because I know a lot of seniors are in nursing homes, and to try to get that extra care, what do you do?
Families, the nursing care staff is just not going to do as good a job on that as the family. Right. And this is why I'm a huge fan, especially for the elderly, of electric toothbrushes. I'm not hung up on any particular brand, but the electric toothbrush, they can move it real slow and let the toothbrush do the job. They don't have to go like this with that. Years before we had the electric toothbrushes, we would actually take a toothbrush and put it in a bicycle handlebar grip, because it was bigger, and people that have arthritis, they could grab that a little better and do a better job. Now we have bigger toothbrushes, and that do so much of the work for you. So we have many more things now than we used to have. So.
Do you see that some of your patients are able to go off any kind of medications? I mean, you talk a lot about bacteria, how it's affecting your body. I mean, tell us about a story of something.
Well, I'm not the one to ask someone to get off of the medication. Right. But one story, we had a gal come in, and the only medication she was on was blood pressure medication. And so we did an examination on her and found out she had a dental abscess. Well, when she went to the physician, they took her blood pressure. It was elevated. They gave her a pill. The blood pressure went down, and everything is fine, right? Well, we did an exam, found out she had an abscess on the lower left area. Okay. We took care of the abscess. Within 3 weeks, she came back and she said, guess what? I don't need my blood pressure medication anymore.
Unbelievable.
Can a dental abscess increase your blood pressure? Absolutely it can. Wow. Okay, your body is trying to get rid of this infection you have going on there. But the side effect of the blood pressure medication is it dries out the mouth. So now you don't have the saliva to dilute the acids that the bacteria are producing. So by putting the patient on the blood pressure medication, not only were you not treating the source, you're treating the symptom, but you're actually making the situation worse by creating a dry mouth. So this is why we have to try and get to the source and not just the symptom.
And that means talk to your physician about what's happening with the dentist. If we could get the dentist and the physicians to work together.
That's my goal.
Yeah.
You know, we have a deadly gap between physicians and dentists. And the military used to have don't ask, don't tell. Okay? Well, we have that in the medical dental field right now. The physicians don't ask and the dentists don't tell. In some areas, they're starting to talk to each other. But we have to understand the mouth is part of the body.
Right.
And whatever happens in here doesn't stay in here. Like I said, what happens in Vegas may stay in Vegas. What happens in your mouth goes through the whole body, no matter what age you are. That includes the mature mouth.
Wow. So one of the other things I'm thinking about is Alzheimer's disease. I mean, when we're talking about you can't really reverse it, but the mouth is tied in with that sometimes.
Well, they've discovered oral bacteria in the brains of Alzheimer's patients, and some of these are triggering the production of something called beta amyloid, which is a bad thing for Alzheimer's. So, again, we talk about a blood-brain barrier, but if the oral bacteria are getting into the brain, obviously there's
not much of a barrier.
Has a leak.
Sure, right.
Yeah.
Absolutely.
So, yes. But that's at any age. These things can be happening in your 20s, 30s, 40s, but you might not get the symptoms until your 60s, 70s, 80s.
So check now. Yeah.
The younger you are, the better it is. Yeah.
All right. Well, we're going to be back with the question of the week.
Here's Dr. Chuck's question of the week.
Hey, this is Irene. Scared to go to the dentist. It's been so many years. I'm afraid of what they will find.
Irene, thank you. That's a great question. Thanks.
Yeah, so you're afraid to go to the dentist because of what they may find. Well, I'm afraid to take a test of what grade I'm going to get.
Right,
you know,
right.
Yeah, we need to. You're so much better to identify the issue and then treat it, because with time it's only going to get worse. So the sooner you can get that examination, the sooner you can find out some of these issues going on, the less involved it's going to be. If it can be filled with just a filling, that's great. But if you wait longer, you might need a crown, or you might need a root canal, or you might need an extraction. So I understand the fear, but just go ahead and do it anyway. Bite the bullet,
so to speak,
and get that examination,
Yeah.
find out what's going on, and then take it from there forward. Now, moving forward, you don't have to zip right down the road. You can take it in stages and steps. So the function is health, and then function, and then aesthetics. But you've got to get that health part in there first.
And you might need to see a couple dentists if you don't, you're afraid. Maybe what they've told you, it's expensive. Go get a second opinion.
Get a second
right?
opinion. Get a third opinion. You don't want to just keep going to get opinions until someone tells you what you want to hear.
Right. Right.
But you want to be able to have communication with the dentist, wherever they are. You want to be able to talk back and forth. You want to find out, what are my choices? What are my options? I mean, you don't need any teeth to have a healthy mouth. Okay? So I would much rather see somebody with no teeth than somebody with infected abscess teeth that don't hurt. Okay? They can smile, they can chew, but they're dumping pus into their bloodstream 24 hours a day, 7 days a week. And then there's such a surprise when, where did I get this heart attack from? Well, you've got to take, this is going on for a long time. Let's nip it in the bud. The sooner you can nip it in the bud, the better it is for your overall health.
So it's not going to make it go away, sticking your head in the sand.
No, ask the ostrich.
Yeah. That's right. All right. Well, we are talking today about the mature mouth, and we're just going to talk about the takeaways. First of all, as seniors, why is it important that we have a clean mouth?
Well, again, you want to prevent as many issues as you can. And so by having a healthy, clean mouth, you're keeping the bacteria out of your bloodstream. You're keeping some of these other toxins out of your bloodstream. So that's number one, is the preventive side right there. So that's an important thing.
The second thing is, if you're on medications, it could cause a dry mouth.
Absolutely. There's, like I mentioned, 400 medications so far that they have identified that will give you a dry mouth. The fancy word is xerostomia. And so they have different over-the-counter things like biotin and some other rinses that you can do that they help a little bit.
Right.
But boy, that dry mouth that's no fun. And when you have a dry mouth, you don't have the saliva to dilute the acids the bacteria is coming from, and your cavity rate goes up. So you want to have a clean mouth.
Absolutely. And the third thing is that there are some things that you can do for extra care, even if you have arthritis or it's difficult.
Oh, absolutely.
Yeah.
You know, electric toothbrushes are great at any age. Fluoride treatments, that when you get to go to the hygienist and you have your teeth cleaned, fluoride treatments for the mature mouth, they're fantastic. Let's cut down, let's prevent, let's not get the cavities if we can prevent them.
Yeah, and I'm just thinking of parents that are in nursing homes, it might not be something that the staff is even thinking about, but maybe this will bring some awareness to say, hey, let's get mom or dad into the dentist. Or do you have a dentist associated with a facility that we could have them checked with?
Yeah, and are there things that you can do to help mom or dad clean their teeth when they're there? So electric toothbrushes are great. I'm not hung up on any particular brand.
Okay.
The one that you're going to use is probably the best one.
Right, right. Very
Doesn't
good.
matter how much you spend for it if it sits in the charger all day long and never use it. So get one. Years ago, like I said, we used to use bicycle handles. We stick a toothbrush in there. Now you can take a regular electric toothbrush.
It's
They're
got
big
that
enough to
nice
hold.
big handle.
Nice big handle.
Yeah.
Even if you have a little arthritis, you can still hold that handle and do a good job.
Yeah, very good. Yeah. Well, be sure to subscribe. We don't want you to miss any episodes. And we just really appreciate you being part of the Your Filthy Mouth family.
Yeah, and I'm asking to spread the word. The whole purpose of this is to help people connect the dots between what's happening in your mouth and what's happening with the rest of your body. This is the front door to your whole body. So just because it doesn't hurt doesn't mean it's okay. So a healthy mouth is a really good thing to have for your mouth, for your smile, for your heart, for your brain, for your kidneys, for your pancreas, everything.
Well, thanks for watching.
Thank you.
This has been Your Filthy Mouth, a weekly podcast about how what happens in your mouth affects the rest of your body. This is important information, so please share it with your friends. Don't forget to hit the subscribe button on YouTube, iTunes, and all the other podcast sites. And drop by yourfilthymouth.com to ask Dr. Chuck a question or find dozens of links to information about oral systemic health. We'll talk to you next week.